Thank you, Chairman. My members, my name is Luis Figueroa. I'm the Director of Policy and Legislation for the Center for Public Policy Priorities. We are in opposition to all four bills. My testimony will mainly be focused on 3 points: the ability on health benefits, the polling, and the research. I want to say that when I'm often frustrated with legislation, I try to give myself perspective by saying, I'm not here trying to save babies, let's not overthink these things. But in this case, I can't say that, because in this case, I do believe we are protecting the health and safety of families, including children, by providing for paid sick leave policies in these local ordinances. And I believe that is why the majority of Texans support these measures, including 74% of all Texans by a conservative pollster has found that they support allowing cities and counties to establish paid sick requirements for local governments and for businesses. This is one of the most popular positions all across Texas, Democrat, Republican, urban, rural. It will impact, and the research shows, for my last point, that 40% of working Texans lack access to paid sick leave, representing 4.3 million people. These are working people who deserve basic working rights. Paid sick leave rights are critical to public health. For example, occupations like food preparation. I don't want someone sneezing on my food, and serving those people and serving all of our residents across Texas. And those are the people with the lowest rates of access to paid sick leave at 19%. In a survey of Houston restaurants, 74% reported cooking or serving food while sick because they lacked access to paid sick leave. For low-wage earners across the state, studies have shown that missing 3.5 days of unpaid work equals a household's entire monthly gross bill. So I ask you to oppose these bills so that families across Texas don't have to choose between their wages and the health of their families. Thank you.
Chairman King.
And thank you, Mr. Chairman. And I'm sorry, somebody else may have asked these kind of questions earlier, but I've been having to go in and out.
Yes, sir.
So how much sick leave is enough sick leave?
So obviously we believe in local control, but generally speaking, these policies are providing for 8 days or a number of hours that are accrued. So they don't get it on the first day on the job. They have to accrue it over a period of time. What we have found in other cities that have done this is that after the initial implementation is very scary, and we know that businesses have a very strong reaction at the beginning.
I guess my question is,
yes, sir.
So, is it 8 days for every type of business and industry? There's some types that you can come to work with a cold, some you can't,
Well, what I would suggest is that every community's got to kind of figure that out for themselves and make sense with their business community, their industries, and their local communities. And that's why I believe in local control and local support. And what we have found that in other cities,
minimum wages? What's the?
Yeah, if I just
how much should minimum wage be?
So obviously in Texas, that's preempted, and we, that's clear law, and that's it. I just wanted to point out the research, because I do think that if anything, we should be looking at the research more than just people's opinion, and what the research has shown.
I get that. I'm just trying to figure it, because on scheduled time for like advance notice on schedules, how long should that be?
Right. So, again, I would just say that this is where local communities need to figure out, and where other cities have done this, they have not found a loss of businesses or a lack of wages. They have found it there.
I'm just kind of you're sitting here as an expert, and I'm just kind of asking for your opinion. Is 2 weeks enough, or does it need to be 3 weeks or 1 week?
Well, if we were going to craft a statewide policy, I would like to, take some studies and figure out what makes sense, what has worked in the past, what has worked in other states. But for local communities, what we ultimately believe is that there should just be a floor for local preemption.
If you can't make a suggestion as an expert, and if we can't make a decision as a statewide, why do we think somebody local can figure out what's right for
because they've taken the testimony and the input from the communities and their businesses and have found what makes sense
for a construction business versus a restaurant business versus someone who works in a bank, that maybe you can come to work when you have a cold, where you can't do that when you're. It just seems like everybody's kind of painting with these big, broad brushes, and I'm just trying to figure out how you do that from a public policy standpoint.
No, I understand your concerns, Representative, and I totally get where you're coming from. I think what I would just say is that let's let the local communities figure this out. San Antonio has said that they are going to go back and review this local funds and make it individualized to the city of San Antonio. City of Dallas has just implemented this. They're also going to take a look at this. So I think that the cities and counties are be able to take the input of their industries and make something that makes sense for their city. So this is a floor for us to take a look at, and that's what the benefit of local democracy is.
I'm not trying to be argumentative. I think you are a little bit, but I'm really not.
I'm sorry, I'm not trying.
I'm really just trying to get my hands around how a city council person in the city of Weatherford, where I'm from, can make any decision of how many sick days are right or what other policies are right for the local realtor or for the local car dealership or for the rancher or for the law firm. I just don't know how they have the wisdom or knowledge to make those kind of decisions for every different type of business that's out there. I'm really not trying to argue with you. I don't really understand how anyone can make decisions for someone else when they have such little information to go by and can paint with such a broad brush and do things in a fair and ethical manner that way.
I understand that, and that's to me the benefit of local democracy, right? To be able to take that input, and just like you are here, you take input, you take testimony.
I would say it's just the opposite, actually.
You don't. The local communities aren't able.
I don't think it's democracy. I think it's dictatorial.
Okay. Well, the elected officials are elected by their local residents, and I think they have the ability to make those determinations. But I totally understand your position.
Chairman Raymond.
I just have to respectfully disagree with my colleague, Chairman King. If you've got a cold, blowing your nose, coughing, sneezing, all that stuff, and you work at a bank, I don't think it's a good idea for you to go to work. Exactly. At least not the bank I go to. Maybe Phil's okay with that. I'm not, for the record.
Representative Harless.
So and I don't want to beat a dead horse here, but you're sitting there saying that you think it should be up to local control to make these decisions as far as that. I live in an unincorporated part of Texas. No city council. Who would make those rules? The hours that they work, days and the days off.
Well, obviously, then if there's no local government to pass an ordinance, then there wouldn't be an ordinance in place. So what we have found is that in the major urban areas, places like Austin, San Antonio, this is a big concern for their local communities. For a non-incorporated area, for a city that has a very small population, it may not make sense for them to pass some type of ordinance, and it probably wouldn't pass in your community, and that's okay. And that's, to us, that's the benefit of local control and local democracy.
Thank you. Any questions for the panel? Thank you all for being here.